Thank you, Gaudens. By the way, in addition to Tanya, Catherine is with us, Katarina Beme, our former chief of cabinet. Now she's the ADG for external relations. I think we will widen the Zoom so you can see who is in the room later, yeah. And I'm really glad that we have started with introduction. And I really like the one word, what you suggested for as one word. Maybe I will start from there. I will repeat action. And I will tell you also which one I had in mind, because I thought Gavin will ask me the same thing. I had it written next to me, then somebody from you had said it. So action, optimist, collaboration, relevance, promise, social participation, inclusion, change, together, community, transformation, innovation, listening to grassroots, equality, impact, and enabling. I hope these words will be our guiding ones in our work together. By the way, the word I chose, because in anticipation that I would be asked the same question, was together. So I was surprised when Thomas said that. So together, I think two, inclusion two, collaboration two, action two, I think from the words, those that go to repeat are four. But I think all 16 words are very, very important. And we have to use them as our guiding principles. Then thank you so much for joining us today to launch the WHO Civil Society Commission through this inaugural first meeting of the steering committee. I thank Lisa Hilmi and Ravi Ram for agreeing to be the first co-chairs and for orchestrating the work of the steering committee, and look forward to working with the co-chairs very closely through them with you and also with all of you. This is a very important moment for WHO and for global health. Listening to the voices of individuals and communities is essential to addressing the challenges they face. We know from our experience in so many areas that listening to and responding to the voices of the communities we serve is essential to properly addressing the health challenges they face. For example, during the Ebola outbreak in the North Kivu and Ituri provinces of the Democratic Republic of the Congo from 2018 to 2020, certain burial customs presented a high risk of transmission. But simply removing bodies from families to protect them created significant community resistance and resulted in some families hiding bodies for fear they would not be able to say goodbye in the traditional way. Through careful engagement with civil society and communities, we were able to design burial practices that were both safe and dignified and acceptable to the communities. And when communities collaborated, I think we contained the Ebola in DRC. We contained it in DRC, although some models were showing that it may spread in the region and throughout the world. But because of the strong participation of communities, we managed to stop it in DRC. And this was a key step in helping to bring the outbreak under control. That is the participation of civil society, and through the civil society, participation of the communities. There are countless other examples in other disease areas. Strengthening WHO's work with civil society has been a key priority for WHO. As part of the transformation we have been making since I began as Director General in 2017. Over the past 6 years, we have transformed our strategy, our processes, our operating model, our culture, our financing, our workforce, and our approach to partnerships. These were the 7 work streams or focus areas that we had. And partnership, by the way, was one of the major pillars in our transformation. Traditionally, as you know, WHO has been shy by design, which I always say, by the way, and too risk-averse in the way we interact with non-state actors, including civil society. But we cannot achieve targets as ambitious as the Sustainable Development Goals without engaging civil society in a coordinated and organized way. That's why we have set up the WHO Civil Society Task Force for Tuberculosis, which is a success, by the way, the WHO Advisory Group of Women Living with HIV, the WHO Civil Society Working Group on Non-Communicable Diseases, and other ways to engage with civil society on specific health issues. I have also held regular dialogue with civil society on topics including long COVID, healthy aging, sexual and reproductive health, traditional medicine, climate change, sustainable financing, and more, to hear directly from them on their challenges and proposed solutions. Because civil society work with the communities, and they know the problems, they know the root cause of the problems, and you know also the solutions. We have also established a youth council and increased our engagement with the private sector while maintaining appropriate safeguards against conflict of interest. We have come a long way, but we're still at the beginning of the journey. Maybe we're still shy by design, but surely we're making progress. We recognize that we must make engagement with civil society more systematic across the 3 levels of WHO, not only with the headquarters, and establish ways to listen to the voices of the people that WHO serves. When I say 3 levels, especially the country level is very important, because that's where we get results. And today, that's why we're here. We have set up the WHO Civil Society Commission, the first of its kind, to bring civil society from different backgrounds together to advise us and work with us so that we can learn from you and be guided by your ideas and achieve the Sustainable Development Goals, which are way off track. The Civil Society Commission will also provide an opportunity for civil societies to learn from each other and to make their voices heard more loudly and clearly. The Civil Society Commission is the central element of WHO's commitment to engage with civil society. And for today, I have 3 aims for this work. First, I encourage you to set the priorities, and I'm looking forward to seeing which issues and topics you identify. I'm glad listening is one of the words you chose. We should start from listening to you, and please don't hold back. Tell us what you think is the right thing to do. Second, we seek your guidance to develop the WHO Civil Society engagement strategy. And third, I hope to engage with you on key organizational priorities, such as the development of WHO's next 5-year plan, the 14th General Program of Work, sustainable financing, the investment round, and the pandemic accord. By the way, on assessed contribution, our member states have made a historic decision to increase our assessed contribution by 20% for 24-25, the budget year of 24-25. This is, by the way, the largest in the history of the organization. Last year, they decided 50% increase, and the 20% this year was part of the 50%. And over 7 years, we will build up to 50%. But that will be one area that we would like to work with, the investment round and the rest, because without sustainable financing, I don't think we can do, we can achieve the ambitious targets we have set for ourselves. Thank you all once again for your commitment to WHO and for improving the way we engage with civil society. I look forward to hearing your assessment on the status of WHO's engagement with civil society and your proposals and recommendations on how we can work better together for a healthier, safer, fairer world. I thank you, and Gaudes, back to you.
Thanks a lot, Dr. Tedros, for those inspiring words. And it's a great pleasure now to hand over